We're backing up north at 4. I'm now joined by Dr. Doug Keele. He's a board-certified orthopedic surgeon. He sees patients in Merrill and Wausau, does a lot of good work. Dr. Keele, thanks for coming on the show.
Thank you for having me. Glad to be here.
So just tell me a little bit about the Bone and Joint Center. What do you guys do?
Well, we're a clinic that we focus on musculoskeletal care. So we have a combination of orthopedic care and pain management physicians. We try to handle kind of the whole spectrum of musculoskeletal care. We have 4 locations. We're located in Wausau, Merrill, Medford, and Plover. And so we see patients from a wide area.
What sort of patients do you cater to? Is it a lot of seniors, or are there people from all different ages?
It really is the whole spectrum. We see patients of all ages, from pediatric conditions and injuries up to geriatrics. And so we really do, between all of our partners, are able to handle the whole spectrum of care.
So I'm sure there's people watching right now who have chronic joint pain. What do you recommend they do?
Well, we always typically start with simple things first. First thing is just to stay active. By keeping active and keeping moving, you're more likely to stay going and have less issues. Weight loss is, of course, important. Obesity is an epidemic and continues to cause joint pain. So you try those things first. And if you're continuing to have issues, then that's when you seek care with an orthopedist to get an evaluation and kind of see where you stand, and start with simple treatments first before we escalate up into surgical treatments if those are necessary.
Okay, let's say that escalation is necessary to go all the way to surgery. What is the operation like, I suppose, to do a joint replacement?
So for primarily the majority of joint replacements are hips and knees. Of course, there are other joints you can place as well, but those are the most common. The joint replacements overall have high success rates. But there are always, occasional outliers where people have still some continued pain or some instability. And so we continue to try to perfect and improve our ways of doing this procedure and optimize our best outcomes. The joint replacements are done by resurfacing the ends of the bones with different forms of metal and plastic, which alleviate the pain.
Okay, so of course, like you mentioned, there's going to be risks, and not every patient will have an amazing outcome. But tell me a little bit about the patients who do have a good outcome from those surgeries.
Sure. And so important components of a good knee replacement are, resurfacing the ends of the bone so they don't grind and rub together and give pain. The second thing would be providing stability to the joint. A lot of knees you'll see on people are very crooked. Sometimes people come in very bow-legged, are very knock-kneed, and so part of the operation is correcting that to give the person a straighter leg again to stand on, and one that's stable. So that's a very important part of the operation as well. And that is one of the main components of our newer robotic systems that helps aid us in getting good alignment and good stability more consistently.
All right, Dr. Keele, let's end on this. For the people with joint pain at home, what should they do?
So again, I think it's important to get professional consultation on this and see an orthopedic surgeon that can give you the spectrum of options, and start with easy things and work your way up to replacements if necessary. Again, the advantages of the robotic system that we're finding are hopefully more consistent accuracy with the alignment, where we can utilize a CT scan ahead of time and load this into essentially kind of a CAD computer system customized to your specific knee. And we can take measurements in the surgery in regards to the alignment and to the balance of the knee, and make immediate changes to our plan to hopefully again land on a much more consistent result and accurate result for a stable knee.
Don't be complacent with living in pain, people. Talk to Dr. Doug Keele if this sounds like a decent treatment for you. Dr. Keele, thanks so much for joining us on the show.
Sure, glad to be here. Thank you.
Okay, we'll be right back after the break.